single liver metastasis located in the right hepatic lobe, segment V. This is a common situation. Identification, detection of metastases in full organs, primarily the liver and peritoneum, of course, but primarily the liver, particularly when we have an already established diagnosis, endoscopically, colonoscopically, of colonic gastrointestinal tract neoplasia and with histological confirmation. In this situation, ultrasound is called for to identify metastases. Here we are dealing with 4 diagnostic sequences. The first is the identification, the detection of the tumor formation. The second is vascular Doppler characterization. The third and fourth is characterization using the contrast procedure. In the upper left, we are on the grayscale image, on a sliding performed on the right lobe of the liver, craniocaudally. Select the convex transducer with the highest frequency, 5-6 MHz, if the liver can be fully visualized. A slow craniocaudal sliding is performed in sequence right lobe, left lobe, and when a region of interest is identified, we stop on it. Here we are dealing with a cross-section with very clear visualization of the tumor formation. It is a classic metastatic appearance with a somewhat more echogenic center and a more hypoechoic periphery, the peritumoral halo. The tumor formation is clearly solid tissue, parenchymal and measurable. It is oval in shape with an anteroposterior craniocaudal axis of about 2 and a lateral axis of about 3 centimeters. So it is a clear tumor formation. The rest of the liver parenchyma is homogeneous. You can also see the liver capsule very well defined without deformities, suggesting that there are no tumor formations under the liver capsule and also the cholecyst. Returning the solid tumor formation detected in a patient with colon neoplasia suggests metastasis with high probability. The tumor is found in the right segment V site. The next step of the examination is vascular assessment using the color Doppler procedure. Color Doppler is not very sensitive, but the method in current equipment allows identification of the supply vessel, the vessel that brings blood to the tumor formation. Sometimes it can even highlight the intratumoral circulatory signal. In this case, a bidirectional Doppler procedure is used with exceptional image quality, where the very slow blood flow can be highlighted by the procedure. This is the inflow vessel. This is an outflow vessel. This is a hepatic vein. The inflow vessel is important because it's going to be smeared on the contrast examination. It should also be noted that the tumor formation does not show, at least in Doppler terms, the circulatory signal. The third component of the examination is characterization using the contrast procedure. This is the specific procedure. We can see in arterial time in the 17th second the tumor formation loaded almost completely, and also by comparison with the Doppler, the inflow vessel, which is also visible. Note that the tumor was loaded first, before the liver parenchyma was loaded. The liver is still insufficiently loaded, and the tumor is fully loaded with signal, harmonic, suggesting high inflow. The last component of the diagnosis, at 3 minutes and 10 seconds, were on the late time. In this time frame, an extensive liver sliding was also done. In arterial time, we stand still with the transductor over the tumor. In the late time, we do extensive sliding, and in the same area where the primary tumor is, we are dealing with an almost complete discharge of the tumor formation. The phenomenon is called contrast washout, and you can compare the appearance of the liver this time being loaded. We are therefore comparing arterial time and venous time. The tumor in arterial time is markedly loaded, and we see the inflow vessel. In the late time, it washes out. The supply vessel is no longer apparent. In arterial time, the liver is underloaded. During late, liver is fully loaded with contrast agent, which makes it easier to visualize the formation. The first dynamic image is the detection of the formation by extensive sliding, and by comparison with what we see on the left, here is the tumor formation in the right lobe of the liver. Then, as I said, in the diagnostic sequence, the next step is the contrast agent loading. Here, in the middle portion, we're on arterial time. The 10th second, the 11th second, the inflow vessel appears. Then the tumor formation is loaded, which is clearly visible while the liver is still underloaded. These images match. Finally, the last image, the one on the bottom right, in which we have comparatively in grayscale the region of interest and, respectively in harmony, the washing area corresponds to this area. We can see the tumor formation that is completely free of contrast agent. The sum of these criteria corresponds to the typical appearance of secondary hepatic neoplasia. In this case, knowing the Precaire point, we are talking about a colon neoplasm with a single metastasis in the liver, right hepatic lobe, segment V.